thank you so much for taking the time with me today and tell me about what you're working on with Mama.
So Mama helps to close gaps in maternal mental health care. We work for physicians and for mothers. So we're an end-to-end solution that helps close the gaps in maternal mental health care.
Yeah.
So things like postpartum depression, pregnancy depression.
Yeah. Oftentimes pitches can sound very clinical, and yet I know that this is an incredibly personal issue. So talk to me about maternal depression, pregnancy-related depression. I know it's more than postpartum depression. It's a whole suite of mental health concerns. So talk to me about the personal side of that.
Yeah, so when I got pregnant with my first son, immediately I went through a severe depression. I had no clue what was happening, talked to all of my care providers and said, there's something wrong, I don't feel right, and was just ushered out of their offices. I wasn't sure I was gonna make it through, or after I delivered, I was definitely I had plans to take my life. Never had a mental health crisis in my life, never had an issue. That was one of the big things I learned, is that no woman is immune. And so this is one of the most common complications of having a baby. And my providers were not prepared and didn't know what to do with me. And I learned that that's pretty common, is the hit or miss of care.
Why are obstetricians so ill-equipped for that situation?
You know, they get barely less than an hour of education of this in medical school, and that's only if the program is sensitive to that. A lot of changes have happened, but the pipelines are still disconnected, and women are having to recreate their path to wellness on their own, so many women don't get better. Yeah.
So you were one of the many women who dealt with this issue. Not everybody then goes and builds a platform. So what was that journey like?
You know, I've spent the past 10 years lobbying Congress, creating awareness campaigns and talking to physicians, and I realized that I could talk about this until the cows came home, and that it wasn't going to change anything. I needed something to help make it easier for them, but I also knew getting physicians to take it, making it easier for them wasn't just the only thing I had to solve. I had to solve how was I going to help women get access to care. So those two things were the cornerstone of creating Mama.
Okay.
And we did it, and it works, and I'm pretty proud of it.
How does it work? What's the platform?
So women screen when they come into their OB or their pediatrician's office using a QR code that's connected to the office. Those results come back immediately to the physician with enhanced talking scripts, because not every physician knows how to talk about it, triage phone numbers, and basically Mama takes care of everything after a positive screen. So that's what the physicians love about working with us. And women love working with us because we are women that understand it. We're there to help them, to normalize it, to let them know that they will get better with the right help. And we help to figure out what that looks like and help connect them to that.
Okay, so I want to talk about that connection piece. So a woman comes in, she takes a screener that you provide. That information goes to the physician, who then also has some talking points, some educational, maybe some things to read. Then what happens if the woman does need help?
If she needs help, that Mama Care coordinator, who is a certified peer support specialist, so a woman with a lived experience, who is trained in CBT, cognitive behavioral techniques and coping skills, and they are there to follow up with her within 24 hours. The average time to get back to her is about 10 minutes. And so we follow up with a phone call and then text, and it looks like about 6 weeks of interaction back and forth. We'll invite her to support groups, we'll talk to her family, we'll help her if she's having a panic attack, or how to manage anxiety, how to get better sleep. We'll also find the right therapist for her if that's what she wants to do, and we circle back with that physician. So we create it's like crowdsourcing, like an extra mental health triage person, specialist for every office, and that's what the real draw is for physicians and patients.
That's amazing. How have hospitals and physician groups responded to this technology?
Oh my gosh, they said they would never screen without Mama. They said it makes them a better physician, which was very healing for me to see them to be so excited about it, and that they use it, and that they appreciate it so much, that they'll even reach out to us for friends that they might have who are suffering from mental health, because they know we're the trusted go-to person, and they know that we'll help, and we know what we're doing.
right now this is prescribed basically through a physician. Is that how it gets to people?
Yeah, so it's different with maternal mental health. If you build it, they don't necessarily come with depression, anxiety, and new motherhood. So it really takes that physician to start off the domino effect for us to get her. That's why we're so effective at what we're doing.
What's your traction been like so far?
Oh my gosh, we have made great headway in DC. We work with the #1 NICU in the country, Children's National Hospital. We have pilots in Los Angeles and Florida, and the March of Dimes has taken a real liking to us. They want to use us in 70 other family NICU centers across the U.S. NICU moms have the highest rates that we've seen of depression and anxiety, and we support them in the NICU and then when they go home. And we won the Johnson & Johnson Quick Fire Challenge in September, which was a really big nod that we're doing something right, and that we knew we were on the right path.
Congratulations.
Yeah, thank you.
Obviously, you have your own personal story. Is there a woman's story that really sits with you and inspires you and gets you going in the morning?
You know, we get stories every week. We have a recent mother right now who's pregnant, and we were able to support her, get her into care. She was having depression in pregnancy. She found out that she has bipolar, and she said, "I didn't even know that you were what I needed." And we stuck with her, and as you know, bipolar, I don't know if you know, but that puts you at an increased risk of postpartum psychosis, which is very scary, and it's a psychiatric emergency. This mom is already being taken care of. She's already being scaffolded with the right support. She's on medicine. So we've just done crisis prevention, and we just made it a lot safer for this mom to go home with her baby, and not have to have it turn into a really bad nightmare or a bad story.
Yeah. I love it.
Thank you.
Maureen, I love the work that you're doing. I love that you use the term scaffold. I think of the potential loneliness of going through this as a mother, and really scaffolding the support around her in a variety of ways. You say you have your peer support folks. Obviously, the OB plays a critical role. Potentially, the therapist. The automated tools. It's all working together in a really cool way.
Thank you.
So, congratulations for the platform.
Thank you.
Wonderful to hear more about it, and wish you an awesome year.
Thank you so much, Logan. Thank you. Thank you.